We have some more Tuesday Transformers coming on in. So let's talk about OMT. OMT is osteopathic manipulation therapy. Osteopathic manipulation therapy. So go ahead and drop that inside the box right now, OMT, OMT. So what's the difference between a DO, where am I, right here? What is the difference between a DO and an MD? So for individuals, a lot of times when you go to a doctor, a lot of people don't even realize that they're seeing a DO versus an MD. So I wanted to hop on real quick, tell you about that, because that's the basis of what we're gonna talk about and what OMT is as well too. So in medical school, I learned every single thing that an MD has learned as well too. We sit for the board exams, we study for 4 years, we have residency. Many DOs go into primary care like myself, but of course you'll find DOs that are surgeons, that are going into oncology. It's just a very vast range. So there's no real limitation to what a DO does and what an MD does. But there is something extra that the DO does learn. DOs learn osteopathic manipulation. And a lot of that is grounded in, since 1874, Dr. Andrew Taylor Still, the one who actually developed osteopathic medicine, he believed that, you know, our body is like a system. It's interconnected, it's interrelated, so that just this one part, if we just focus on one part of the body, then when we're treating disease or diagnosing something, then we are ignoring so many other factors that are influencing that. And that is a lot of what OMT is about as well too. So osteopathic manipulation treatment really focuses on the whole system. So ever since 1874, I want to say that Dr. Andrew Taylor Still was ahead of his time and really looked at medicine from a holistic approach. And that holistic approach really underscored the reality is that it's an interrelated system. Our entire body is an interrelated system that can affect different parts. So a manifestation of a symptom in one area, the real root or the real cause of that problem could be someplace else. So how does that all play into play when we talk about osteopathic manipulation therapy? Well, osteopathic manipulation really is literally a hands-on approach. A DO, and not all DOs use their OMT skills. Of course, when you're in surgery, OMT is not going to do anything for you, right? So I doubt highly a lot of my colleagues who are surgeons are using their OMT skills when they're actually performing surgery. But there is a reality that a lot of patients, they obtain immediate relief of pain, that is without using any medications and not using any invasive therapy. So this is our non-invasive, no medication, immediate relief of symptoms for any pain. And this happens constantly. We do it here in the office, osteopathic manipulation therapy. And a lot of the pains that people will have that really it helps with will be low back pain, chronic headaches, individuals who have headaches as well too, and just sports injury types pain. We actually diagnose with our hands. So why does all that come into play? This is going back to what Dr. Andrew Taylor Still mentioned back in 1874, and this interrelated system. He noticed that our musculoskeletal, right? So we're gonna break down the word Tuesday Transformers. Muscular, our muscles, skeletal, our bone structure. Any misalignment, any change in that at all can affect our nerves. Those nerves then radiate to various organs in our body. And those various organs, when those nerves radiate to those various organs in our body, it has this manifestation of different symptoms and different pain. What do I mean? Well, I mean, like the other day, of course, if you are a physician and you're watching, or if you have a family member that's a physician, what's the first thing that happens when you have a family gathering, right? Everyone's asking the physician and saying, hey, I got a pain right here, I got a pain over here. So that's exactly what happened during our holiday weekend. Actually, my brother came into town from Nashville, High PA, and what was occurring with him is that he was just having a lot of aches and pains in his side, right? On his right side. He was having some aches and pains on the right-hand side. And of course, he said, Sabin, can you treat me? Can you do some OMT? And of course I did. Well, the pain that he was having really on the right-hand side was really coming from just the tightness in his hamstrings. So when I was able to go ahead and just feel, so I'm going to give you little secrets of what I do here in the office with patients that come in for OMT. I first feel for any change in the tissue. That change in the tissue, like a muscle, when it's tightened a little bit, remember our muscles are attached to our bones. That little bit of tightening on the muscle can actually add just a little bit of movement or a little bit of change in alignment to the bone. And that's enough for you to start feeling some discomfort or pain. So when you do that progressively over time, when you have a regular ergonomics, regularly the way you're sitting or standing, when that continues to go on over time, you start having that pain. Well, I'm going to say, of course, my brother, because I could say this about him. His little bit of discomfort and pain was causing some more tightness on the bone structure. And as I went ahead and treated him, I realized what was it coming down to was really a misplacement of one of his ribs. Now I'm getting really scientific here because I know my Tuesday transformers, they appreciate when I go into education and educating them. So I ended up just treating one of his ribs. I treated his ribs. And what occurs with our ribs, this is called our bucket handle ribs. When we breathe in, it goes up. And when we breathe out, it goes down. Breathe in and breathe out. It goes down. Well, what was happening with him is that he was breathing in, but nothing was coming up. But then he was breathing out, and I just felt it kind of ride more. So how did I feel that? My hands. And this is literally spending hours on hours in the lab in medical school, just really diagnosing each other, feeling our muscle structures, feeling the different body components, and then getting an understanding of what we're feeling. So I felt that his ribs were not going up when he should be breathing in, and they were just remaining down. So we did a simple technique. One of the techniques that I use, and there's many different techniques that you could use. One of the techniques that I used for him was a muscle energy technique and a little bit of counter strain. So that muscle energy, I asked him to breathe in a certain way, and then I begin to lightly elevate that rib to follow the motion in which it should go to. Here's the beautiful thing about our body. Our bodies, they really do have the ability to heal themselves when they're in perfect alignment. So I wanted to bring his body into alignment. Now, when I say heal themselves, that means that we cannot necessarily eradicate some of these horrible illnesses like cancer, but definitely when it comes to musculoskeletal discomfort and pain that we feel when we bring our bodies back into alignment, that patient that I was speaking about, when I brought his ribs back into alignment from breathing in and breathing out, probably about 15 minutes, just really focusing on that area, had him get up, move a little bit more, and relief of symptoms. And honestly, it's just that simple. I'll be quite honest with you. The first time I heard about OMT, I was intrigued. And it actually was the decision I made not to go to an allopathic medical school, but actually go to an osteopathic medical school because I was just really intrigued and wanted to learn more. And I will never forget when Dr. Bosler, hi Dr. Bosler at Nova Southeastern University, he was teaching us about OMT, and he brought a patient in. And guys, I honestly tell you that it almost looked like a televangelist type of service I was watching, because the patient came in with such pain, kind of hunched over, just holding their pain. And I saw Dr. Bosler just do all this different treatment, movement, couldn't really understand what he was doing. And then saw the relief that patient get up and move and have that full range of motion that they did not have before. It almost sounds like, yeah, right, that doesn't exist until you get treated. So until you go to a DO and get an osteopathic manipulation therapy, I'm telling you, you'll be a believer. I have family members who suffer from headaches. So a lot of times I do what's called OA decompressions. When they're having that severe migraine headache, what we do, again, our body is all interconnected. I do a release at right their occipital area. I do a release for them, and that headache that was just debilitating to them, just within a matter of 5 minutes or so, they get that immediate comfort from just a simple procedure. And why am I talking to you about this? I'm talking to you about this because I want you to be well informed. I want you to know about all the tools that are available to you. And I want you to put them in your toolbox to use them when needed. There's definitely individuals who are not having to live in pain, and they're not having to take these medications every single day. They're not having to go through extensive, invasive procedures because they are getting regular OMT treatment. Now, most DOs, like myself, when we do our OMT treatment, we also educate our patients too. We start looking at the different factors in their lives, their regular ergonomics that may be eliciting or causing their pain a little bit more, and we make those adjustments. So if you are interested in just learning about a little bit more about OMT and just trying to, I have this idea of what exactly is it, will it work for me? Simple, go find an OMT doctor, go find, not an OMT doctor, excuse me, go find a DO who actually practices osteopathic manipulation therapy, and I'm sure they will be so happy to take care of you. If you're in the Coral Springs area, of course, you could come here to Cornerstone Medical Group. We'd love to take care of you too and see you, and I think that it will make a difference for you. So I'm so glad you could join me today. I know that you still have lunch to go to, and I'm so glad that you're able to come in. I want to say hi, of course, to Senny Tassi, who's always here as a Tuesday Transformer here on Facebook. I want to say hi to Aline Elon. Good to see you. Glad you could join us. Evelyn Unbreakable, Nora Luce. Good to see you. Rodney 25. Hey, Tuesday Transformers. 04 Choo Choo. Damien 1EN. I'm going to reach over here to Elisee Johnson. Hi, Tanya Deli. Good to see you. I'm SFR 7126. Glad you could join us. The Tuesday Transformers. Russell and Damsel. Good to see you. Heart to Heart Ludley, always great to see you. Look at all the Tuesdays Transformers here to transform their health. If you think that this information could be helpful to someone else, please go ahead and share it with them, because we need to know what's going on in our bodies, and we need to know about the different options that are out there. If you're like me, you don't like taking medications and you don't like to live a life on medications, and more than anything else, I personally always want to know the why of something and how I could prevent something and how I could stay away from it and steer clear of it before it gets worse. So if that's you and you think it's gonna be helpful to someone else, go ahead and share this video. Like always, I will see you next week, Tuesday, for another talk with our Tuesday Transformers. Let's Talk Tuesdays, 12:30, same time, same place, and have a great week. Happy New Year, guys. Bye.